The medical assistant must wear sterile gloves to perform sterile procedures in the medical office. These procedures range from changing a sterile dressing to assisting with minor surgery. You must know how to apply and remove sterile gloves without contaminating them or yourself. Wash your hands with an antimicrobial soap before putting on your gloves. The warm, moist environment inside a glove provides ideal growing conditions for microorganisms on the hands. Washing your hands with an antimicrobial soap removes these microorganisms and also deposits an antibacterial film on your hands to discourage the growth of bacteria. Choose the appropriate size gloves. If your gloves are too small, they may rip as you apply them or become uncomfortable to wear. If they are too large, you may find it difficult to perform your tasks. Next, place the glove package on a clean, flat surface. Open the glove package without touching the inside of the wrapper. Your hands are not sterile, and the inside of the wrapper is sterile. Note that the tops of the gloves are turned down to form a cuff. Holding your hands above waist level, pick up the first glove by the folded back cuff with the fingers of the opposite hand. Make sure not to touch the outside of the glove with your ungloved hand. After you apply the glove, the inside of the cuff touches your skin and is no longer sterile. This is why you can pick the glove up by its cuff. Step back and pull the glove on. Allow the cuff to remain turned back on itself. Stepping back prevents your unsterile hand from passing over the sterile glove still in the glove package, which could contaminate it. Keeping your hands above waist level, pick up the second glove by slipping your sterile gloved fingers under its cuff and grasping the opposite side of the cuff with your thumb. The cuff is sterile and may be touched with your sterile gloved hand. Pull the glove on. And turn back the cuff. Turn back the cuff of the first glove by reaching under the cuff with the other gloved hand. Both the glove and the area under the cuff are sterile. Do not allow the sterile glove to come in contact with the inside of the cuff. The inside of the cuff is contaminated because it was previously touched by your clean hand. Adjust the gloves to a comfortable position. Inspect the glove for tears. If there is a tear, remove the gloves and put on a new pair. Wearing sterile gloves protects your patient from your unsterile hands. After the procedure is over, your gloves are contaminated. During the sterile procedure, the outside of your gloves may have become contaminated with blood or other potentially infectious materials. You must protect yourself as you remove them by not allowing your bare hands to come in contact with the outside of the gloves. Remove the sterile gloves by grasping the outside of one glove 1 to 2 inches from the top of the glove with your other gloved hand. Slowly pull the glove off your hand. It will turn inside out as it is removed. Pull the glove free and scrunch it into a ball with your gloved hand. Place the index and middle fingers of your bare hand on the inside of the glove. Do not allow your bare hand to touch the outside of the glove. Pull the second glove off your hand. It will turn inside out as it is removed, enclosing the balled-up glove. Discard both gloves. If your gloves are visibly contaminated with blood or other potentially infectious materials, discard them in a biohazard waste container. Otherwise, they can be discarded in a regular waste container. Sanitize your hands thoroughly as required by OSHA to remove any microorganisms that may have come in contact with your hands.